People with a psychotic disorder, for example schizophrenia, have an increased risk of developing metabolic disorders, such as obesity, high blood pressure, high cholesterol and diabetes. We also know people with a psychotic disorder are more likely to use cannabis compared to the general population. In our study we therefore examined whether there was a relation between cannabis use and metabolic disorders in these patients. We were able to include over 3,000 people with a psychotic disorder from a large ongoing cohort study in the Netherlands. The majority of these patients were not using cannabis. All patients participated in a physical health examination, which included measuring their body weight, their waist circumference and blood pressure. We also collected a blood sample of each patient to test for diabetes and check their cholesterol levels. When we compared the patients using cannabis with the non-users, we discovered that the patients using cannabis weighed less, were skinnier and had lower blood pressure than the patients who were not using cannabis. However, the patients who were using cannabis did have more severe psychotic symptoms, in particular hallucinations and delusions. After approximately 1 year we measured all of these patients again. Some of the cannabis users from the first assessment had stopped using cannabis during this year. In these patients, body weight, waist circumference and blood pressure had increased more than in any of the other patients. But on the upside, their psychotic symptoms had also decreased more than in any of the other patients. So our experiment showed that cannabis use in people with psychotic disorders is related to both metabolic disorders and the severity of psychotic symptoms. We therefore concluded that encouraging patients to stop using cannabis is often a good idea because it will likely decrease their psychotic symptoms. But it is important to realize that quitting cannabis may have a negative impact on patients' physical health. Therefore, monitoring metabolic risk factors and offering treatment, such as lifestyle interventions, is highly recommended when these patients stop using cannabis.